Hello everyone, myself Dr. Dhruv Prajapati, third year radiology resident in Department of Radiology in Government Medical College Surat. I would like to thank my co-author Dr. Hinal Bhagat sir, Associate Professor in Department of Radiology, Government Medical College Surat. I am presenting a paper on pleomorphic adenoma of the major salivary glands, diagnostic utility of MRI. Introduction. Pleomorphic adenomas are the major tumors of salivary glands. They are called as benign mixed tumors because they have mix of glandular epithelium and mesenchymal tissues. Parotid gland is the most affected gland in the salivary glands and most common for the benign tumor of each salivary glands. They are also seen in the lacrimal glands, external auditory canal, breast and vulva. Aims and objective of the study to evaluate the diagnostic utility of MRI in identifying pleomorphic adenoma of the major salivary glands. To analyze MRI features suggestive of pleomorphic adenoma, T1, T2 stir DWI images. To correlate MRI findings with diagnostic confirmation method like FNAC. Clinical features. Pleomorphic adenomas are commonly occurring at 40 to 60 years of age with female predominance. They are typically asymptomatic, solitary, slow-growing, painless masses which progressively enlarge, which may be found by the patient or usually not noticed by the patient and discovered by the physician in clinical examination. Sometimes they are found incidentally in the MRI obtained in evaluation for the other disorders. Occasionally, they show rapid growth within few months if they transform into the malignancy. Investigations. On clinical examinations, they feel as formed or hard mass in the salivary gland region. On USG, they show well-defined hypoechoic ecotexture lesion with or without posterior acoustic enhancement. On CT, small adenomas show homogeneous hypodense attenuation with prominent enhancement. Large adenomas shows heterogeneous attenuation with less prominent enhancement, which may show calcifications or necrosis. Role of MRI in diagnosis of pleomorphic adenoma. MRI imaging is the imaging modality of choice in any parotid lesion. MRI is accurately diagnosing a subset of pleomorphic adenoma cases with high degree of certainty. Multiple studies have shown that the MRI for the pleomorphic adenoma shows around 85% specificity and MRI plus FNAC shows around 95% of specificity. On T1 weighted images, the lesion shows low signal intensity. On T2 weighted images, the lesion is well defined and high intensity, typically in myxoid type or intermediate signal intensity with sharp margins with uniform or heterogeneous nodular enhancement. On stir and diffusion weighted imaging, it shows a high signal intensity. MRI findings in the favor of pleomorphic adenoma are T2 weighted bright or intermediate intensity, sharp margin, heterogeneous nodular enhancement, and lobulations. Material and methodology. A retrospective study was conducted on 121 patients, came to our department for the neck swelling, and MRI study was done in that patients. MRI studies were reviewed by a radiologist for findings suggestive of pleomorphic adenoma, and 5 cases were identified. Case 1, a 65-year-old female patient with complaint of right-sided face swelling. FNSC in that patient was also done, which was suggestive of pleomorphic adenoma. T1 weighted images shows the hypointense lesion, and T2 stir and DWI images shows a hyperintense lesion on the right side of parotid gland. Second case, 50-year-old male patient with complaint of left side mandible swelling. History of trauma 1 year back, and FNSC was also done in this patient, which was suggestive of pleomorphic adenoma. Third case, 66-year-old female patient with complaint of right-sided parotid gland swelling, and USG was done in this patient, which was suggestive of pleomorphic adenoma. A 41-year-old male patient with complaint of right-side face swelling. Images are T1 weighted images shows a hypointense signal on the lesion in parotid gland. T2 and stir and DWI images shows hyperintense lesion in the parotid gland on the right side. 42-year-old male patient with complaint of left side of face swelling. The lesion is appearing in the parotid region, which is similar to the previous case. Like T1 images shows hypointense signal in the lesion, and T2 and DWI images shows hyperintense signal. Differential diagnosis of the pleomorphic adenoma can be benign or malignant. Benign differential diagnosis can be Warthian tumor, cystadeno-lymphoma, oncocytoma, infantile hemangioma, lipoma, benign lymphoepithelial lesions. Malignant lesions can be carcinoma ex pleomorphic adenoma, carcinosarcoma, adenoid cystic carcinoma, mucoepidermoid carcinoma, or metastasis. However, the major drawback of the MRI as diagnostic marker is the low sensitivity because it is ineffectively distinguished between benign pleomorphic adenoma and other parotid masses. Management of the pleomorphic adenoma. A complete surgical excision of the tumor with adequate margin is useful in the small adenomas. Parotidectomy is the main treatment for the large pleomorphic adenoma, and interval follow-up should be done for the local recurrence of the pleomorphic adenoma after excision. Conclusion of the study: highly specific MRI algorithm for reliable identification of pleomorphic adenoma among primary parotid gland tumors by testing the diagnostic reliability of the algorithm that incorporates multiple individual findings that have each been shown to have the high positive predictive value. However, the major drawback of the MRI as a diagnostic marker is low sensitivity because it is ineffectively distinguished between benign pleomorphic adenoma and other parotid masses. FNSE are more reliable and accurate for the diagnosis than other imaging modalities. Combination of MRI and FNSE increases sensitivity and specificity for pleomorphic adenomas. Thank you.